Welcome to an overview on research study designs in the health sciences. Research design decides how research materials will be collected. One or more research methods, for example, experiment, survey, interview, etc., are chosen depending on the research objectives. In some research contexts, a survey may be suitable. In other instances, interviews or case studies or observation might be more appropriate. Research design actually provides insight into how to conduct research using a particular research methodology. Basically, every researcher has a list of research questions that need to be assessed that can be done with research design. So research design can be defined as a framework of research methods and techniques applied by a researcher to incorporate different elements and components of research in a systematic manner. Most significantly, research design provides insights into how to conduct research using a particular research methodology. Research methods mean techniques, strategies, processes utilized in data collection or finding evidence for analysis in order to explore new information or create a better understanding of a particular research topic. There are basically two research methods: qualitative research methods and quantitative research methods. Quantitative methods intend to measure facts in mathematical and statistical models. Qualitative methods try to gather detailed, rich data, allowing for an in-depth understanding of research phenomena, seeks the why rather than the how. Many research works make use of mixed methods approach. A mixed methods approach uses both qualitative and quantitative research methods in order to gain a more comprehensive understanding and explanation of the research problem being studied. A rule of thumb for deciding whether to use qualitative or quantitative research design is use quantitative research if you want to confirm or test something, such as a theory or hypothesis. Use qualitative research if you want to understand something, such as concepts, thoughts, or experiences. This tree diagram lays out the four study design groups in healthcare and their relationships. They are basic studies, the animal and lab studies; observational studies, which include both descriptive and analytics designs; experimental studies, into which randomized controlled trials fall; and finally, meta-analysis and systematic reviews. And here is a larger view of the observational studies section of the tree diagram, which lays out descriptive studies and analytical studies, in which case reports, cross-sectional studies, and correlational studies fall, and case control studies and cohort studies. Observational studies generally fall into two groups: descriptive studies and analytic studies, though some studies can be found in both groups. In observational studies, treatment or exposure of interest is not assigned but occurs by choice or happenstance. It depends on a population's natural or voluntary exposures to factors not randomly assigned. The possibility exists that exposed and unexposed populations or patients differ in important ways that can affect an outcome. It provides evidence about new or unusual conditions, disease frequency, etiology, and risk, and fall into two types depending on whether or not there is a comparison group. We will now dig deeper into the different study designs. First up are case series and case reports. These consist either of collections of reports on the treatment of individual patients with the same condition or of reports on a single patient. Case series and case reports are used to illustrate an aspect of a condition, the treatment, or the adverse reaction to treatment. For example, you have a patient that has a condition that you are unfamiliar with. You would search for case reports that could help you decide on a direction of treatment or assist on a diagnosis. Case series and case reports have no control group, one to compare outcomes, so they have no statistical validity. The benefits of case series and case reports are that they are easy to understand and can be written up in a very short period of time. Here is a graphical representation of case series and case reports. Starting on the left is a selection of patients. Their chart notes are analyzed, and the results may then be turned into a journal article. Some of the pros of case series and case reports are that they are simple in design, can be written up quickly, easy to interpret or understand, and an important step in recognizing new diseases or risk factors. Some disadvantages of case series and case reports are that they involve no research hypothesis. Some authors will use them to imply causation or therapeutic benefits with little evidence, and you can't use them to test for valid statistical association since there is no comparison group. So here are some screenshots of 4 examples of case series case reports. A case-control study is designed to help determine if an exposure is associated with an outcome, that is, disease or condition of interest. First, cases are identified, a group known to have the outcome, and the controls. A group known to be free of the outcome, or in other words, patients who already have a certain condition, are compared with people who do not. Then a look back in time to learn which subjects are in each group had the exposure, comparing the frequencies of the exposure in the case group to the control group. Case control studies are generally designed to estimate the odds using an odds ratio of developing the studied condition or disease. They can determine if there is an associational relationship between condition and risk factor. By definition, a case-controlled study is always retrospective because it starts with an outcome, then traces back to investigate exposures. Case-controlled studies have specific advantages compared to other study designs. Here is a graphical representation of case-control studies. Starting on the left are a group of patients with the condition of interest, along with a group of patients without the condition. Their histories are taken and compared, then conclusions are drawn. Case-control series are useful for obtaining preliminary data prior to preparation for a more complete study. They are also relatively quick and inexpensive, require fewer subjects, are appropriate for investigating outbreaks, and are good for studying rare diseases with long latency periods. The disadvantages of case control series is that they depend completely on high quality existing records, and it can be difficult to define an appropriate control group. They also have more possibilities for biases or errors than any study method, and statistical association between exposure and disease is not sufficient to demonstrate causation. Here are screenshots of 3 examples of case-control studies. Cohort studies, also called longitudinal studies, involve a case-defined population who presently have a certain exposure or receive a particular treatment that are followed over time and compared with another group who are not affected by the exposure under investigation. Cohort studies may be either prospective, that is, exposure factors are identified at the beginning of a study and a defined population is followed into the future, or historical retrospective, where past medical records for the defined population are used to identify exposure factors. Cohort studies are used to establish causation of a disease or to evaluate the outcome impact of treatment when randomized controlled trials are not possible. For example, one of the more well-known examples of a cohort study is the Framingham Heart Study, which followed generations of residents of Framingham, Massachusetts. Here is a graphical representation of cohort studies. Starting on the left is a group of interest, those with the condition, and a comparison group, those without the condition. These groups are watched over time and then outcomes are compared. Some of the advantages of cohort studies is that they are useful for studying the causes of a condition, the course of a disease, or the risk factors over a long period of time. Also, selection bias generally is not a problem, recall bias not a problem, and researchers can look at more than one outcome or a disease. Some of the disadvantages of cohort studies are that they are not as reliable as randomized controlled studies, since the 2 groups may differ in ways other than the variable under study. They also involve long follow-ups, may require many subjects or potential non-participation bias, and due to the long time between exposure and effect, it can be difficult to determine the precise relationship between risk factor and a disease. Here are some screenshots of 4 examples of cohort studies. Correlational research is a type of non-experimental research in which the researcher measures two variables and assesses the statistical relationship. Correlation means association. More precisely, it is a measure of the extent to which two variables are related. Researchers use correlations to see if a relationship between two or more variables exists, but the variables themselves are not under the control of the researchers. There are three possible results of a correlational study: a positive correlation, a negative correlation, and no correlation. Correlational research is a preliminary way to gather information about a topic. The method is also useful if researchers are unable to perform an experiment. So while correlational research can demonstrate a relationship between variables, it cannot prove that changing one variable will change another. In other words, correlational studies cannot prove cause and effect relationships. Correlational research often uses scatter plots to depict relationships. Unfortunately, it is really easy to show correlation where it might not really exist. In this instance, bicyclists killed in collision with stationary objects correlates positively with people dying from falling off of ladders. The interpretation of correlation results can also be very tricky, such as the correlation that cancer could cause cell phones. Some of the advantages of correlational studies are that they are quick and relatively inexpensive, they allow researchers to collect much more data than experiments, and they allow researchers to determine the strength and direction of a relationship so that later studies can narrow down the findings and, if possible, determine causation experimentally. The disadvantages of correlational studies is that they only uncover a relationship and cannot prove a conclusive reason for why there is a relationship. They do not reveal which variable influences the other, and they do not provide information about the relationship between risk factor levels and disease in individuals. Here are some screenshots of 4 examples of correlational studies. A cross-sectional study involves looking at data from a population at one specific point in time. The participants in this type of study are selected based on a particular variables of interest. Cross-sectional studies are observational in nature and are known as descriptive research, not causal or relational, meaning that you can't use them to determine the cause of something such as a disease. Researchers record the information that is present in a population, but they do not manipulate the variables. In a cross-sectional study, the investigator measures the outcome and the exposures in the study participants at the same time. Unlike in case-controlled studies where participants are selected based on outcome status, or cohort studies where participants are selected based on exposure status, the participants in a cross-sectional study are just selected based on the inclusion and exclusion criteria set for the study. Once the participants have been selected for the study, the investigator follows the study to assess the exposure and outcomes. Cross-sectional designs are used for population-based surveys and to assess the prevalence of diseases. They may be conducted either before planning a cohort study or as a baseline in a cohort study. Here is a graphical representation of cross-sectional studies. Starting on the left is the study population, which is divided into the control group and the case group. Each group is then further divided into an exposure group and a non-exposure group. Some of the advantages of cross-sectional studies are that they are a good starting point for research, as it can be used to prove and or disprove assumptions. They are the best way to document burden of disease in a population at a specific point in time, are relatively inexpensive in cost and time, they can represent a target population, and the data can be used for various types of research. The disadvantages of cross-sectional studies is that they have a tendency for recall bias. It is difficult to determine the cause. Is it the chicken or the egg? There is a tendency to overinterpret results. The timing of the snapshot is not guaranteed to be representative, and it cannot be used to analyze behavior over a period of time. Here are screenshots of 3 examples of cross-sectional studies. The basic concept of experimental study design is to study the effect of an intervention. In this study design, the risk factor or exposure of interest or treatment is controlled by the investigator. That then makes these hypothesis testing studies and can prove the most convincing demonstration of evidence for causality. As a result, the design of the study requires meticulous planning and resources to provide an accurate results. Experimental studies are less susceptible to confounding because the investigator determines who is exposed and who is unexposed. In particular, if exposure is allocated randomly and the number of individuals or groups randomized is large or the study is double-blinded, then even unrecognized confounding effects become statistically unlikely. Experimental study designs can be divided into 3 broad categories: clinical trial, community trial, and field trial. Clinical trials are also known as therapeutic trials, which involve participants with disease and are placed into different treatment groups. Randomized controlled trials are one type of clinical trial. Community trials are also known as clustered randomized trials. They involve groups of individuals with and without disease who are designed to different interventions or experiment groups. So groups of individuals from a certain area, such as a town or city, or a certain group, such as a school or college, would undergo the same intervention or experiment. Field trials are also known as preventive or prophylactic trials, and the subjects without the disease are placed in different preventive intervention groups. One of the hypothetical examples for a field trial would be to randomly assign into groups a healthy population and to provide an intervention to one of the groups, such as a vitamin, and following through to measure certain outcomes. Hence, the participants are monitored over a period of time for occurrence of a particular disease process. Here is a tree diagram of experimental study designs laid out relationships that are just described. Now we will go a bit deeper into clinical trials. A clinical study involves research using human volunteers that is intended to add to medical knowledge. There are 2 main types of clinical trials. Clinical trials, also called interventional studies, and observational studies. ClinicalTrials.gov includes both interventional and observational studies. In a clinical trial, participants receive specific interventions according to the research plan or protocol created by the investigators. These interventions may be medical products, such as drugs or devices, procedures, or changes to participants' behavior, such as diet. Clinical trials may compare a new medical approach to a standard one that is already available, to a placebo that contains no active ingredients, or to no intervention. Some clinical trials compare interventions that are already available to each other. When a new product or approach is being studied, it is not usually known whether it will be helpful, harmful, or no different than available alternatives, including no intervention. The investigators try to determine the safety and efficacy of the intervention by measuring certain outcomes in the participants. For example, investigators may give a drug or treatment to participants who have high blood pressure to see whether their blood pressure decreases. Clinical trials are further divided into randomized clinical trial, non-randomized clinical trial, crossover clinical trial, and factorial clinical trial. Randomized clinical trials, or RCTs, involve randomizing subjects with similar characteristics into 2 groups or multiple groups. The group that receives the intervention or experimental therapy and the other group that receives the placebo or standard of care. A non-randomized clinical trial involves an approach to selecting controls without randomization. With this type of study design, a pattern is usually adopted, such as selection of subjects and controls on certain days of the week. Depending on the approach adopted, the selection of subjects becomes predictable, and therefore there is bias with regards to selection of subjects and controls that would question the validity of the results obtained. In crossover clinical trial study design, there are 2 groups who undergoes the same intervention or experiment at different time periods of the study. That is, each group serves as control while the other group is undergoing the intervention or experiment. A factorial trial study design is adopted when the researcher wishes to test 2 different drugs with independent effects on the same population. Typically, The population is then divided into 4 groups. The first with drug A, the second with drug B, the third with drug A and B, and the fourth with neither drug A nor drug B. The outcomes for the drug A are compared to those with drug A and B, and to those who are on drug B and neither drug A nor drug B. The advantages of this study design that it saves time and helps to study 2 different drugs on the same study population at the same time. As previously noted, randomized controlled trials are studies in which there are 2 groups, one treatment group and one control group. The treatment group receives the treatment under investigation, and the control group receives either no treatment, a placebo, or standard treatment. And most importantly, the patients are randomly assigned to all groups. Randomized controlled trials are considered the gold standard in medical research. They lend themselves best to answering questions about the effectiveness of different therapies or interventions. Randomization helps avoid the bias in choice of patients to treatment that a physician might be subject to. It also increases the probability that differences between the groups can be attributed to the treatment under study. Having a control group allows for comparison of treatments. For example, treatment A produced favorable results 56% of the time versus treatment B, in which only 25% of the patients had favorable results. There are certain types of questions or populations on which randomized controlled trials cannot be done for ethical reasons. For instance, if patients were asked to undertake harmful experiences like smoking or denied any treatment beyond a placebo when there are known effective treatments. Here is a graphical representation of randomized clinical trials. Starting on the left is a group of patients who are then randomly assigned to either the treatment group or the non-treatment control group. The groups are followed over time, and then treatment results are compared. A double-blind randomized control trial is the type of RCT in which neither the medical staff or physician nor the patient knows which of the possible several treatments or therapies the patient is receiving. A double-blind study is the most rigorous clinical research design because in addition to the randomization of subjects, which reduces the risk of bias, it can eliminate or minimize the placebo effect, which is a further challenge to the validity of the study. Here is a graphical representation of a double-blinded randomized clinical trial. On the left are the 2 treatments, with only the study manager knowing which treatment is which, the physician then randomly allocating the 2 treatments to the participants in the study. Some advantages of the randomized controlled trials are that they allow for rigorous testing of a single variable in a precisely defined patient population. They are subject to the least number of problems and biases, and they are the best type of study to test the efficacy of a treatment or a procedure. Some of the disadvantages of randomized controlled trials are that they are expensive, very time-consuming. Ethical considerations prevent the use of randomized controlled trials to study certain conditions, and they may introduce hidden biases through faulty randomization. Here are screenshots of 3 examples of randomized controlled trials. A systematic review is a comprehensive survey of a topic that takes great care to find all relevant studies of the highest level of evidence, published and unpublished, assess each study, synthesize the findings from individual studies in an unbiased, explicit, and reproducible way, and present a balanced and impartial summary of the findings with due consideration of any flaws in the evidence. In this way, it can be used for the evaluation of either existing or new technologies and practices. A systematic review is more rigorous than a traditional literature review and attempts to reduce the influence of bias. In order to do this, a systematic review follows a formal process. There is a clearly formulated research question. Published and unpublished, such as conferences, company reports, file drawer reports, etc., literature are carefully searched for relevant research. Identified research is assessed according to an explicit methodology. The results of the critical assessment of the individual studies are combined, and the final results are placed in context, addressing such issues are the quality of the included studies, impact of bias, and the applicability of the findings. Steps in a systematic review are similar to those in the evidence-based practice process, with an additional 3 steps. Formulate the question, develop a protocol, conduct the literature search, select studies, appraise the studies, extract data, analyze results, and finally, interpret the results. Here is a graphical representation of a systematic review, where both published and unpublished studies are collected, put through a rigorous analysis, which requires a systematic review. Since systematic reviews use explicit methods to limit bias, its conclusions are more reliable and accurate than any other type of study, and the results of related studies can be formally compared to establish generalizability of findings and consistency of results. Some disadvantages of systematic reviews are that they are very time-consuming, as most systematic reviews take a year or more to complete. They are costly in the terms of staff times, as they require a team of at least 2 researchers, and they require the application of statistical methods to assess the reliability of the studies. Here are screenshots of 3 examples of systematic reviews. Meta-analysis is a systematic, objective way to combine data from many studies, usually from randomized controlled trials, and arrive at a pooled estimate of treatment effectiveness and statistical significance. Meta-analysis can also combine data from case-controlled and cohort studies. The advantage to merging these data is that it increases sample size and allows for analysis not otherwise possible. They should not be confused with reviews of literature or systematic reviews. 2 problems with meta-analysis are publication bias, studies showing no effect or little effect and are often not published or just filed away, and the quality of the design of the studies from which the data is pulled. This can lead to misleading results when all the data on the subject from published literature are summarized. Here is a graphical representation of a meta-analysis where the statistical results of selected studies are combined or pooled. Some advantages of meta-analysis is that they increase the sample size by merging the data from several studies. They can give a more precise estimate of an intervention's effectiveness, and they help determine whether the effects of an intervention are similar in studies. Since individual studies that show no or little effect are rarely published, a meta-analysis is subject to publication bias, and the quality of a meta-analysis depends entirely on the quality of the individual studies it synthesizes. Here are some screenshots of 3 examples of meta-analysis. We have examined various research study designs. No one study design is perfect. Each design method processes different strengths and weaknesses in answering research questions. Depending on the type of research question, practicability, and resources in terms of manpower, money, and time, the investigator has to choose the appropriate study design which will answer the research question in the most scientific manner. If you are interested in learning more, here's a set of readings for further study. The Health Sciences Library has services to help with your research, whether it is researcher support, help with a literature research, or if you just need to meet with a librarian. We are here for you.